I'm Dr. Dennis L. Rousseau, surgical oncologist, fellowship trained in surgical oncology at MD Anderson, and I'm here to talk to you today about skin cancer. So when we talk about skin cancer, the first thing is the two important risk factors, which are your natural skin pigment and your sun exposure history over your lifetime. People who have lighter pigmented skin are far more at risk for skin cancer than people with darker pigmented skin. Sun exposure has the majority of the risk associated with it, and so areas of your skin that have been heavily exposed to sun are the most likely places where it will develop and where you should check. There are three common types of skin cancer. There's squamous cell carcinoma, basal cell carcinoma, and melanoma. Basal cell and squamous cell carcinoma are the most common types of skin cancer. They are not pigmented or colored, and they occur in sun-associated areas, and they're generally new growths on the skin that occur that weren't there. These are treated easily in the dermatologist's office, and they tend not to spread, nor do they tend to be life-threatening. The most concerning of these skin malignancies is melanoma. Melanoma is a pigmented lesion, usually starts in a mole. We use the A, B, C, D, E criteria to look at your moles to determine if there's a risk for melanoma. A is asymmetry. A normal mole should be nice and round with smooth edges. B is border. The border shouldn't have any irregular areas. C is color. The color should be uniform. If it's not uniform or the color has changed, that's a concern and should be evaluated by a dermatologist. D is diameter. The bigger the mole, the more concerning it can be. We generally use a 1/4 inch as a marker. If it's smaller than a 1/4 inch, it's probably okay. If it grows to be bigger than a 1/4 inch or it's already larger, it should be looked at by a dermatologist to ensure that it's not something more concerning. And the last is evolution. You had one small spot, it's now two, or the spot was small and now it's larger. Any change in a colored lesion should be evaluated by dermatology. The best preventative thing you can do is avoid sun exposure. So unfortunately for most of us, we've gotten most of our sun exposure as kids before we really use sunblock appropriately. But in all cases, avoiding the sun when you can, using appropriate coverage when you're out in the sun, and that includes sunblock appropriately applied, and using clothing that has a sun protection factor already built in, can prevent the sun exposure or decrease the amount of exposure to UV radiation, which causes the multiple forms of skin cancer. And lastly, wear a hat when you can, because it's very difficult to get sunblock on your scalp. Your hair does not block all of the sun, and keeping the top of your head covered can really decrease the amount of risk of scalp skin cancer. Skin cancer removal is generally done in a dermatologist's office for basal cell and squamous cell cancers. Melanoma is a little different. I'll talk about that in a second. The main ways that it is removed is from cauterization or burning of the cancer on the skin in the office. They can freeze it with liquid nitrogen, or they can do a procedure called Mohs surgery where they shave the skin cancer off and check the margins while you wait and then close the defect once they've removed the entire lesion. Melanoma, because it's a more aggressive lesion, generally requires a larger surgical operation and sometimes requires assessing lymph nodes, and that's generally done in an outpatient setting in the hospital. I think the main thing is get to know your skin, get to know or acknowledge what your sun exposure has been, and after 50 or 60, especially if you are lighter skinned and you've had a lot of sun exposure, make an appointment with a dermatologist and have them do a complete skin evaluation. They will be able to tell you what your lifetime risk will be in the future, and they'll be able to set up appropriate surveillance for you in the years to come.